Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Tremendous heel pain.
Okay.
Most of it is on the bottom of the heel, from here, and it radiates out this direction.
In the plantar part
Yes.
of your left foot.
Yes.
Okay. How long has this been going on?
Okay, so this started from running,
Okay.
and it first happened in April or early mid-April.
Mid-April, we are in July, so that's about like 3 months ago.
Yes.
Okay. So when that happened, what kind of treatment you had there?
Yeah, so shortly after the pain kicked in, I went to urgent care.
Okay.
And they put me on some pain meds. They gave me a shot for pain.
Okay.
And told me to roll on a frozen water bottle.
Okay.
And told me to contact my primary doctor.
Okay. So have you had any orthotic, massage, chiropractor, or PT, or anything like that?
So yes, I did. The only thing I did was I went to my primary doctor.
Mm-hmm.
She said that she thought I probably had plantar fasciitis.
Okay.
But she said I could send you to a specialist, but they probably will give you some cortisone injections and tell you to get an orthotic. So I did go get an orthotic.
Okay, so you get orthotic, but you still experience the same pain.
Yes.
Okay. So can you describe the pain? What kind of pain? How much from 0 to 10?
Yeah. So the pain, the biggest part of the pain is in the heel.
Okay.
And it probably starts somewhere in the midpoint and starts to radiate out. I feel like micro tears. I feel like I'm walking on broken glass.
Okay.
And so probably a level 8 is constant.
Okay.
And it might go down to a level 6, but it never gets below that.
Okay.
It's also pain on the top of the foot.
And when the pain in the top of the foot occur?
It's probably about the same time.
About the same time?
Yes.
Okay. So, and I see a little bit swelling here. There's kind of like hard tissue. So that's happened at the same time?
I think it happened at about the same time, or I noticed it about the same time.
Okay. So do you feel more pain in the morning when you?
I do
take a few steps in the morning.
I do feel more pain in the morning.
Or after rest too.
I do feel more pain after rest. It's early in the morning, and then it starts to loosen up a little bit when I'm walking around during the day, but it comes back. It comes right back.
Okay, so you have a kind of like classic plantar fasciitis symptoms. So the pain feel like sharp, or like you are on sharp surfaces, and especially in the morning or after rest. But usually with chronic plantar fasciitis, especially when we have some more inflammation, the pain lingering and does not really stop. Some acute stages, some patients just feel the pain more in the morning, and then things calm down.
Yes. Okay,
so we know you have like currently 8 out of 10 just pain.
Yes.
Without putting weight on it. So I will have you walk. We're just going to watch the way you walk.
Okay.
And I want you to let me know how much pain from 0 to 10 walk.
Okay.
You're definitely guarded. How much pain do you feel?
It's probably about the same. It's probably an 8 right now.
Is that why you're walking slowly like this?
I just don't have a lot of confidence now in just regular activities like walking, like I did before.
Okay. All right. Okay, initially I'm gonna work on a proliferation stage, which means like working on the scar tissue, the fascia restriction, just to rule out if your symptoms primarily from scar tissue and fascia restriction, muscle spasm. And we'll see, based on how you respond to this, we'll determine what we're gonna do if you have inflammation, okay?
Yes.
Okay, so everything should be pain-free, okay? Make sure you let me know. So it's start here, yeah?
Yes.
Or here, right in here?
Yes.
Okay, make sure, I know you have a constant pain. I want to make sure that I'm not increasing that pain. As long as it's not increasing, that's fine, okay?
Okay.
You should feel pressure there. Pressure is okay, but we don't want to aggravate your symptoms. You feel this tightness here?
Yes.
The fullness here? That's a scar tissue deep in there. Okay. How's that? We have a system called fascia system. Normal and the superficial layer, it's like a wrap surrounding the entire body. It's like a Spider-Man suit. Very thin layer under the skin. So when you have fascia restrictions, it's like you're wearing a t-shirt 2 to 3 sizes too small, okay?
Yes.
So normal fascia movement should be feel like nice and smooth like this.
Okay.
Okay? So when we have fascia restrictions, it feels like this. Moving a little bit here and a little bit here, but when we get here, it's kind of like stuck, you know. And I remember, like you were saying, you have dull aching pain, right?
Yes.
Is that correct?
Yes.
Yes. Okay. That's before we start the video. So I'm gonna release your fascia here. So how does feel now? You feel the mobility?
Feels good.
Okay. So just releasing the fascia, superficial and apparatic fascia here. Okay. And I actually, with the A5, I start to release the fascia restriction in your plantar fascia. And I will show you. So normal muscle, when you don't have a scar tissue, it should feel not nice and smooth like here. You feel that?
Yes.
Pliable. There is no like lumpy, like a scarring hard tissue internally. Okay.
Right.
Compared to this one, you feel this bump here?
Yes.
Okay. So that's a scar tissue. The problem with the scar tissue, our muscle should act like a rubber band. When you contract and relax and stretch like this. So when we have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. And that's actually the calf muscle, because you have a scar tissue here. It will not elongate enough to really help with the mobility of the ankle. And that causes stress and compensation on the plantar part. So it takes most of the load here, and that could lead to micro tear here to have more scar tissue. As I feel here, more scar tissue here, and more scar tissue here. And I'm not surprised you have the scar tissue, because the way you were walking, you know, and this foot, I notice it's more inward compared to this foot.
Okay.
It's like your car out of alignment, so you're gonna wear one side more than the other. You will have a micro tear more in one side to compensate that alignment issue. Okay?
Yes.
Alright, so here is the knot. Feel it here, right here, very deep here. Okay? Make sure it's not too much, okay?
Okay.
How's that?
It's okay.
Exactly with plantar fasciitis, the tightness here, because the calf muscle should be elongate when you walk. Okay?
Okay.
So if that does not elongate much, it gonna actually pull this upward.
I see.
Okay, so some patient could be the calf causing this, or a combination of the calf tightness because you have alignment issue, because you have bad shoes when you're running with bad ergonomic. So it's kind of like could be a combination of a lot of things that you start to stress this tissue, have micro tear there to compensate for the tightness here, for the turning foot here, and you start to build more scarring here. And that's why you feel like you're standing on like sharp surfaces, because that scar is very thick, like it's like a rock internally. When you put weight on it, you can feel like there's a rock pushing on it. Does that make sense?
Yes.
So yeah, so it could be several reasons, usually several reasons to cause that tightness, and that tightness could be also from that alignment issue too.
Okay.
So for plantar fasciitis, the causes, it could happen from bad ergonomics, you know, bad anatomy, bad shoes, bad orthotics. Those are risk factors for it. Plus, if you have like very high arch, or most likely dropped arch, which is like pronated foot. So those are the common risk factors.
You know, I tried some things. I tried a massage gun.
Mm-hmm.
I tried foam roller.
Mm-hmm. Yeah.
I tried a TENS unit.
Okay.
None of these
Well, they don't break the scar tissue. They don't release fascia restrictions. They don't decrease inflammation. It's basically just masking the symptoms. Based on the studies, sometimes you might get temporary pain relief or no pain relief, you know. So they're not gonna go deep enough, and the massage gun is not targeting the tissue. It's just randomly hitting you.
Yeah.
You know, even with the massage, it's really hard to go deep enough with the finger or the elbow when someone does massage. That's why I invented this tool, the A5, that actually I can go deep in the tissue up to 2 inches, 2 inches and a half. So if we cannot apply mechanical force on the restriction, we will not be able to release it. It's like, you know, you try to unscrew a screw in a motor, but the screwdriver is short. You will not be able to reach it. You cannot unscrew it.
Yes.
That's exactly the same concept for soft tissue restriction, like fascial restriction and muscle and scar tissue. If you cannot exert mechanical forces internally to do the release, you're not really releasing. Here, when you do that, you feel this bump here?
Yes. Oh, yes.
There you go. You feel how nice and smooth this?
Yes.
Okay, compared to this.
Oh.
So that's a scar. Yeah, because it causes muscle spasm and pulling on the muscle. You know, as long as just let me know if it's too much, I will decrease the pressure. Okay. So, but you feel those bump here. And you can see it here with the tool, like it's kind of like going over rock. In the plantar part here, feel that grinding here?
Oh, yes.
Okay. So that's, and you feel that here? It's
yes.
Actually, I hear it here. It's because I'm very close, and actually with this tool, it gives me more vibration feedback when I get on the scar tissue compared to regular tissue. Here. Actually, you can hear the sound. Feel how nice and smooth here?
Yes.
There is no scar tissue. But when I get to this spot,
yes,
it feels like I am running over a washboard or like small rock or sand with the tool. Feel that?
Yes. Oh, yes. Oh.
It's really very grinding here. A lot of scar tissue very deep in that area. So I'm actually shaving it up with a superficial layer here. And then I will try to see. Okay, so we start with constant pain at 8 out of 10. Okay, move it around and tell me how's the pain now.
It's definitely reduced.
0 to 10.
It's probably down to a 3.
Okay, went down to 3. So you definitely have a little bit inflammation, so we need to work a little bit more on inflammation. That's a good sign because your constant pain out of 8 out of 10, that's a lot. So let's walk and tell me from 0 to 10 how much pain with the walking. And I want you to try to walk this diagonal this way, okay? 0 to 10?
It's down to a 2 or 3.
Oh, nice, beautiful. Keep going. And if you don't feel much pain, you can speed it up a little bit. I know you said you're very guarded,
yes.
You know, so look up nice and tall and just walk. How's that now?
It's much better.
0 to 10?
It's down to a 2 or 3.
Beautiful. That's very good. Okay. So definitely you have a little bit inflammation. That's why we need to use the MagnaHeal more. So I gotta do more MagnaHeal on it, and we'll test it again. Okay. All right. So today is your third visit here. So can you give me a quick overview how you were feeling before the treatment and your progress, how you feel today?
Yes, before I came, I was in terrible shape. I mean, just in pain every day almost continuously from morning until night.
Mm-hmm.
And
how much pain from 0 to 10 you used to experience?
It was the range from 6 to 8. It could get up to a 10, but it would mostly
constant
at the 8 stage.
Mm-hmm. And okay, today how you feel?
I'm feeling much better. Just a huge improvement. Over the last 3 days, the work each day has been progressively. I'm feeling better, much better.
So you had this for 3 months or?
Yeah, 4 months.
4 months, and we had just 3 visits.
Yes.
And you tried other treatment before. So let's actually have you walk back and forth and tell me how you feel walking.
Yeah, I'm feeling much better.
Before it was constant pain.
Yes.
Okay.
Now I have the orthotic in my shoe.
Mm-hmm.
And
you're working on proper posture.
Working on the proper posture.
And we release the scar tissue, the fascia, and the inflammation. That's good. Okay, you can have a seat. Okay, so after the 3 treatments, so what do you think about ASTR treatment?
Without going through this, I would have been, I believe, at that stage 8 pain for a long time, indefinitely. An intervention was required, and I think this was a huge decision for me. It was a very good decision, and it's been very helpful.
That's good. So you're feeling better?
I'm feeling much better.
That's good. Awesome.
I feel like I'm on a good path.
That's very good. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to astrinstitute.com.